So I'm pretty excited. I'm here with Marisa today, and Marisa just finished up a 10-month program with us, right, Marisa?
Mm-hmm.
And why don't you tell us a little bit about why you originally came to our office and just some of the things that were in your health that you were struggling with?
Okay. Well, a lot of the things I was struggling with my health were I was just tired, had no energy. My digestive system was often messed up, and I didn't really understand what it was that my body didn't like. What foods were setting that off. I had high blood pressure that was getting higher, and the regular doctor that I see, basically for all of these things, wanted to put me on high blood pressure medication, which I did try, and I felt even worse on that. It just really made I felt like it made the inflammation in my body worse. I was stiff all the time. I felt horrible, which in turn made me actually move around and have less activity. So I had already gone off of that and told her that I wanted to try losing weight, doing something else to get my blood pressure back down. Yep. I think those were the main things. And I'd been tested for thyroid issues many times. They never found, I was always low in the range, but I was never out of what they considered the normal range. Right. They did find that I was low in vitamin D, and I would be briefly put on a high dose of vitamin D, but I would come back in another year or two and it would be pretty low again. Yep. So, and I think my emotions were really out of whack. I had a lot of premenstrual syndrome, so those are probably the main things that I was struggling with. And really the only answers I had was, you're going to need high blood pressure medicine and here's some vitamin D. That's kind of the majority of the help that I got from the traditional medical community.
Yeah, and that's pretty common, and that's actually, like we were talking just earlier, this is part of why we do these video testimonials, so that people can hear, real people in real time know that there are obviously options out there above and beyond just, medicating the symptoms away.
Right.
And that's why I'm excited to obviously be here with you today, just so that people can hear just what it was like for you and how, many of these things in your health have changed. Mm-hmm. What would you say was the biggest impact, of these various, concerns that you had, and how they were impacting your health? What would you say? How would you describe their impact on your life in general?
Well, I think I was just getting more and more inactive, and my emotions were more and more out of control. I think I was depressed, and it just felt like a downward spiral where I just kept getting heavier. I mean, I didn't gain all my weight at once. I gained a few pounds or several every year, and I could never take it off and keep it off. And so that kind of adds to it too. So you just become less active and more depressed and fatter, and it's just like a big downward spiral, and you feel kind of stuck.
Absolutely, yeah. It's a vicious cycle, like you
right.
said. What? So tell us. So I know weight loss was one of the big things that you noticed, and I know you've been awesome in terms of just being very consistent with the dietary changes. And why don't you tell us a little bit, how much weight did you actually lose?
So far I've lost just over 40 pounds. 40 pounds. In about 10 months. Yeah. And still going down. Yeah. And my goal wasn't really to lose it all at once. I mean, I know it took me about 20 years to gain it all. Right. So in my mind, I thought if it takes me a year or two to lose it all, I'll be fine with that.
And you did it healthy. That's the thing. You didn't do any kind of fad diet. You ate clean.
Well, and when I made the eating change, I really thought of it like this is a change in how I'm going to eat for the rest of my life. Absolutely. This is not a diet. Right. This is not something I'm going to do until I lose my weight. I'm just going to change how I eat, and then the weight will come. And really, the first week, I lost like 2.5 pounds, and that's when I thought, wow, because I needed to see that right off the bat it was going to make a difference. And absolutely. Pretty consistently, I've been losing. Some weeks I stay, but the scale I'm on, it shows I'm losing a little bit of fat percentage. So sometimes it's the percentage, sometimes it's the weight, but it's consistently coming off in a way that keeps me motivated too. Yeah,
that's huge. What other changes did you say that you noticed? Energy levels?
Much more energy. I mean, I used to, even just cleaning the house, I would sort of have to take a break and sit down, and I have a lot more energy. I can keep going during the day. My sleep used to be really bad. I used to wake up a lot, used to be sweaty at night, and those things have gone away. my eating, as long as I'm sticking to my program, nothing really like irritates my stomach or my intestines.
Yeah.
I don't get gassy. I don't have other problems. So it's really made things a lot better.
Yeah, absolutely. How long were you suffering with a lot of these health problems? Obviously, you said there was kind of like this just perpetual downward cycle, but how long would you say, going back, that you were experiencing these problems?
Well, my weight has pretty much been my whole life. I've yo-yoed up and down, and I tried lots of different diets, even like in high school and college, and so that probably my whole life. And then the high blood pressure and the really feeling tired and not motivated and really depressed, probably really badly for the last 5 or 6 years.
5 or 6 years.
Yeah.
Isn't that cool if you think about it? 5 or 6 years of just, perpetual downward spiral, that in just a very relatively short period of time, 10 months, and it didn't take you 10 months to obviously feel how good you're feeling now, but in 10 months you've reversed 5 years worth of this downward spiral.
Right.
And you've literally added years to your life. That's what's exciting. What would you tell people that perhaps, are going to stumble upon this video, they're going to watch this video, and, they themselves are struggling, and perhaps, like I say all the time, they're thinking that the handful of pills that they're taking are the answer, and while we're not advocating here to people to just stop taking their medications, there's obviously a better way, right? What would you tell to those people, that are out there that are watching this? What would you tell them about our practice and your experience in our office and just how it's changed your life?
Well, I think what I would say was the reason I went looking for Dr. Hagmeyer is because I just really felt in my heart like I did not want to slap medications on my issues. And I really wanted to understand, why is my body doing this? There has to be a reason behind it. And I did talk to my other doctor, and I said, I really want to look at my hormone levels and my vitamin levels and everything. Yeah. And basically, I was told by that doctor that, well, we don't really know what normal ranges are for those things. Right. So we did tests, but then there was really no plan based on those tests. And honestly, that's what I really liked about Dr. Hagmeyer, is that you ran all the tests. Yeah. I was really going to understand what is going on with my blood, what is going on with my stomach, what is going on with my vitamin levels and my hormone levels, what's normal, what can we do about it besides putting me on medications, because they were wanting to put me on medications for my weight too, and I just really wanted to know why. Yeah. If my body is functioning correctly, then these things wouldn't keep spiraling out of control. There has to be a reason somewhere that somebody can understand. So that's why I came here, and I just wanted to find something, whatever it was. And the funny thing is, I had looked at like the paleo type of eating plan before, and I'd read it, and I thought, oh, that's way too hard to do. So when I had my first meeting, then you said, you're going to have to, this is the eating plan. I was like, okay, well, joke's on me. I mean, I already knew. I had, at different times, I had cut out dairy and I had cut out grains, and I always felt better, and I was able to lose a little bit. So I think that's the other thing. In my heart of hearts, I knew that would work. I just thought it was too difficult to do. But once you actually see on paper, hey, your body cannot process dairy, and I was eating literally 3 to 5 servings of dairy every day, and wondering why I felt awful. So I think it was just, there is a way that you can do it. You can find out what's really going on in your body. You can make changes that will help, that are not involving medication. And that's really what I wanted. I wanted to know, what is my body doing? There must be ways to measure it, and how can we change that without medication? So that's what I was looking for, and that's what I found here.
Yeah. Well, I think that was awesome. I want to obviously just close, this video and this testimony with just, an appreciation for you being you're a great patient.
Thanks.
You did really, everything we asked you to do, and obviously, you weren't doing it for me. You were obviously doing it for you, so that, you'd have, a better quality of life, and that you would, not continue down the path that you were going. So you were very motivated and just great to work with, because you had that willingness to want to succeed.
Right.
You know, so I want to thank you for doing this testimonial.
Thanks.
And
Can I say one more thing?
Absolutely.
I think the other thing is it's really hard work, and you have to know that and commit to it up front,
Yeah.
but it's worth it in the end. And I think sometimes, and I think I've thought this too, it's easier to slap a pill on it and hope that'll make you better.
Yeah.
It's way easier than totally changing your eating habits, cooking from scratch, which I never did a lot of. I lived
Right.
on fast food and eating
Right.
out.
Yeah.
But making a big change and committing to it can really change how you feel, and it's worth it in the end.
Yeah, that's so true. Well, thanks again for doing this. We appreciate it.
Thank you.
Absolutely.